Hello, everybody. I'm wearing a wig because I don't know how to cut my hair and it's in my eyes. And this was the wig that I would have used for the Roaring 20s as well. I've had it for a while. It's got blue in it, whatever. So don't be shocked. And there's Rick Olson. Hi, Rick. Okay. Thank you all for coming today. It's really nice to see your faces. And also, please mute yourself when you're not speaking. Bill Gryle is co-host. He's recording this. It'll go on YouTube. And Stephen is going to speak today when he gets in here. And I don't see him yet.
So
let's hear from Carrie.
Here's one thing folks can do. If you click on the Manage Participants button at the bottom of your screen, and I'm not sure where it is on an iPad, I'm on a laptop here.
Yeah.
What'll pop up is a window that's got the names of everybody who is with us today on the meeting. And check your own name if it shows up as like iPad or iPhone, and you can see that in your window if you got your camera turned on. You can rename yourself so we can see who it is.
Okay, so Carrie, can you tell us about the hand sanitizer project? What happened?
I can.
Good.
I think that we've had the second batch now picked up by Tom Bennett and Steve Schneiderman, and it is over at Steve's store. And they are going to be delivering that out. He and Amy Bailey made the second list, so we'll be getting those batches out to the businesses. And then I think there was a reminder in your email that everyone in the club can have 2 8-ounce containers of the small sanitizers if they want to stop by and pick them up from Steve's business, and he will even run them out to the car for you. So if anybody has questions about that, call Steve Schneiderman or email Steve Schneiderman, and he will he'll get those questions answered. And then we'll be picking up another batch, the third batch, in about a week, I think. And that's all we bought for updates, Eva.
Thank you. Anybody have any questions on the hand sanitizer project?
Mm-hmm.
So Steve Scheiderman, how many do you have left of those little ones?
Oh, a lot. Probably almost 200.
Whoa, okay.
So yeah, I hope members will come get some. If not, we'll probably give the small ones back to SOEB, and we'll just continue on with our gallon bottle distribution. If I may, I would like to add on to Carrie's report that we have reached out to our neighboring Rotary clubs of Reedsport, Coquille, Myrtle Point, and Bandon, and offered gallon bottles to those clubs to distribute to their first responders in their communities. And we're working through Assistant Governor Chris Hainsworth to facilitate that. We have not heard back yet if they are going to take us up on the offer or not. And quickly, I want to say hi to Charlie Kocher, who has joined us, is back in town.
Okay. And also, Steve, can you tell us about the Paul Harris Fellowships?
Nothing too much new to report. Many of the members took advantage of matching points to contribute cash, and then points that we are harvesting from Dane Smith, who graciously offered up matching points. And Tom Bennett is in the process of obtaining Dane's signatures on papers to turn into the Rotary Foundation to get those people their first Paul Harris.
Thank you, Steve. Okay, Diego, do you want to say a few words? We're leaving for Seattle tomorrow.
Yeah.
Okay.
So I want to say thank you to the club for this year. Thank you, Eva, and thank you to all the people that are like been helping me with everything. And yeah, I'm leaving tomorrow, May 7th, and I'm going to Seattle and then Dallas and then Madrid.
And Steven's gonna take you surfing tonight.
And Steven's gonna take me surfing tonight.
And he got up last night for the first time, and I got it on picture. Okay, so anybody else have anything to say? I'm going to turn this over to Stephen to talk to us if nobody else has anything they want to say right now. No? Okay. Why do we keep seeing him?
So I'm on. I'm here.
Okay, there you are. Okay, so this is Dr. Stephen Shimotakahara. I think you all know who he is. He's a head and neck cancer surgeon, ear, nose, and throat specialist at North Bend Medical Center and chairman of the board and a Rotarian. And he's going to talk to us about NBMC and what they're doing there during this crisis of COVID. So go ahead, Stephen.
Yeah. Hey, thanks everybody. So I was checking my my records on email, and I realized that it's been 6 weeks since North Bend Medical Center closed down for everything but urgent and emergency cases. And I must say, 6 weeks, it seems like an eternity actually, because you know, things have been moving very, very slowly since that time. But I really do believe that the closure of North Bend Medical Center had a major effect upon perception in the community about the importance of social distancing. And I believe that we've been successful, at least so far, in flattening the curve of COVID-19 in our community. And hopefully that's a trend that will continue. And I believe that that's really, really important because so far, and you know, all I can say is, you know, hopefully this will continue. We do not have any COVID-19 cases in our ICU at the hospital. And although we've had some cases at the Shutter Creek prison, there's been some extension of that contact into the community. So far, it's relatively limited. And I believe that all of these efforts have been somewhat successful. I would like to describe what life is like at the clinic, and for that reason, I'm going to share my screen with everybody right now. So can everybody see the screen?
Yes. Yes, I think so.
Can everybody see? Okay.
Yes.
So I just went and walked around on Friday morning and Monday morning and took shots of different activities around the clinic. And just to show you what the clinic looks like in this time of changed services. So this is our front door. You can see this is a patient who is being screened for COVID-19 symptoms prior to coming into the building. And so she's having her temperature checked. Some of the questions include whether she's had a cough or a fever or any travel outside of the community. You can see that there's a hand sanitizer there, so people are encouraged to wash their hands. And everybody, that includes providers, all the support personnel and patients all wear a mask. And during their entire visit to the medical center, there's definite social distancing. In this case, this patient is here because underneath that blue little bear, panda bear blanket is a baby. And I don't know how old, but it's important for children, especially infants, to receive their vaccinations. And so they're a group of patients that have to be seen in the office. And so she's one of the few patients that are coming in for a face-to-face visit in the clinic. Otherwise, and I'll do the next slide here. Otherwise, the clinic is largely empty. And this is 9 o'clock. I took this picture on Friday morning, but I could have taken the same picture on Monday morning at 9 o'clock in the morning. And normally at 9 o'clock in the morning, this hallway would be jam-packed with people. Pretty well all the chairs would be filled with people waiting. And way, way, way down the hallway, you can see one person way at the very end of the hallway. And that person just happens to be the cleaner, because North Bend Medical Center has established an aggressive program of cleaning everything. We're cleaning door handles, banisters. Everything is wiped down at least once a day, and sometimes several times a day. So the importance here is to try to create a very, very safe environment. And the reason why the clinic is so empty is that people are still having their medical needs attended to, but it's all done either remotely or directly outside of the hospital. So going back, so I would say that, and I've talked to several providers, greater than 90% of the patient visits that would otherwise have been in the office are taking place remotely. So people are having their medical needs attended to either over the telephone or by video conferencing. And video conferencing can be with all sorts of platforms. We're talking about DoxyMe, Facebook, just about Zoom. And a lot of the providers, particularly in primary care, are providing services not only from their offices, but actually from home. So the idea is to actually create less foot traffic through the building and therefore create more social distancing. And as an example, this is the lab. This is the entry point where you check in at the lab. And you can see, first of all, it's empty, 9 o'clock in the morning. And you can see those little blue bars on the floor. Those are spaced every 6 feet. So if people do arrive and there's more than one person waiting for their services at the lab, they are still social distancing in front of the lab so that there won't be any transmission. You can see that a little further on is X-ray, and that also has significantly reduced services. And that's the lab on the inside. This is the lab on the outside. And in fact, this outside blood-taking station is more busy than the inside blood-taking station. So, you know, just in general, how do you access services at North Bend Medical Center? The first thing to do if you have something that you need attended to is you just call your primary care. And based upon whatever you describe as your need, your visit could be done remotely, either on the telephone. It could be done under some kind of video conference call, or in this case, if you need lab work, and you can see this is also not only the general lab, but it's right here is that the little sign for the coag clinics. So people who are on Coumadin that need regular blood work do not have to go into the actual building to have their coagulation tests monitored. So what happens is you phone up, you make an appointment, and you drive up to this station where somebody will come out of the building and take, phlebotists will come and take your blood through your car window. And they will all be appropriately masked. And what this does is it reduces the actual contact between people by reducing the traffic in the building. So that's our lab inside, lab outside. This is a typical office visit done on the outside. So This is one of our primary care nurses, and she's doing a diabetic check. So she's taking a blood pressure. She's actually also giving a specific medication by injection. And she's, again, doing this at the curbside to try to reduce traffic on the inside. Now, there are, many situations where this can't be done. Somebody in congestive heart failure, somebody who has a very, significant medical problem, they need to be seen on the inside. But visits like this and visits done remotely and virtually take up over 90% of our visits at this point in time. This is what we call the respiratory care unit. Okay, this is the entryway to a very specific unit that we've created that has an external access point. And so what we did was we used this doorway into a separate portion of the clinic, and we renovated the inside building to be isolated from the rest of the building. So if you call up your primary care and you say you got a cough and a fever, you still need to be seen, but you won't be seen in the regular clinic because, as I said, we don't want to create transmission through the building of people who are symptomatic with respiratory symptoms. So you would arrange an appointment. You drive up to this door, and again, you would access your services through this portion of the clinic. This is the front desk on the inside of that respiratory care unit. Everybody's masked. And all of this whole area is separate from the rest of the clinic. And this is one of the examination rooms in the respiratory care unit. So these rooms have been renovated to specifically address people with possible COVID-19 illnesses and be cared for on the inside. So anybody with symptoms of a respiratory nature that need to be seen because of the seriousness of their symptoms would be seen on the inside in this isolated unit. But the vast majority of people who have respiratory symptoms and, for instance, would need to have a COVID-19 test will be seen on the outside. And here you have one of our nurses actually taking a nasal swab on somebody who may have COVID-19. You can see how appropriately dressed they are. And the whole idea is that they can receive this service by driving up and then driving back home, where they will self-isolate themselves. So there are other access points. For instance, pediatrics. I mean, kids get a lot of respiratory symptoms. They just get colds like crazy. And some of those might be COVID-19. So we have a specific entryway for pediatric patients with respiratory symptoms. And this is how I believe that we're able to still provide medical services in a safe fashion without creating a hotspot of COVID-19 within our facility. So I just wanted to stress to you the importance of what I believe the importance of what we're doing, and how we believe that we're reducing the risk to our community while still providing services in a variety of ways.
So, Stephen, you're finished. You're going to take questions. You're going to now. So, anybody with questions? Is that you, Jesse? Are you have a question?
No, no question.
Okay, you just came up.
I got a question.
Yeah.
Well, Stephen, this COVID-19, do we know what kills it? You know what I mean? Like CDC site says, bleach water, but do like cold, heat, UV light, things like that kill it?
Yeah, there's a lot of things that kill it. So far, we don't have any specific medication or vaccine that will kill it on the inside of our bodies.
Right.
So we do have studies that show that UV light is actually quite effective in killing it within several minutes. So putting in, for instance, Eve and I, as you know, are living separately, but we share meals, and the dishes go from her portion of the house into my portion, but things that go back the other way after I wash and do the dishes, but to send the dishes back into her area of living, we leave it on an outside table for a couple of hours where it's exposed to the sunlight. And that apparently is very effective in killing the virus. Things like bleach and all of the common disinfectants like Clorox, and they all kill the virus. But what also actually kills the virus is simple soap. And the reason why it does that is the soap will dissolve the lipid coating of the virus. Lipid means the fat coating of the virus, which is its plasma, its cell membrane. And so just plain old soap is very effective in killing the virus. As we all know, as Rotarians recently, alcohol. Alcohol kills it very well, and for the same reason that soap does, it dissolves the fat layer on the outside of the virus. Can't think of anything else, but lots of things kill that virus. Some of the things that, the virus apparently lives better in a cold, humid environment. And so that's where some of the theories occur that this is going to go away in the summer. But the problem with that, and the reason why people believe that it will go away in the summer relates to the way common colds go away in the summer. Okay, so we are plagued with coronavirus type illnesses with the common cold every winter. But the difference between that situation and the situation we have right now is that the vast majority of us have a partial immunity to the common cold, because we've all seen different coronavirus cold viruses on a regular basis. So everybody in our entire population has a partial immunity to the common cold. So if you can reduce your exposure by the virus being less active in warm air, summer air that's relatively wet or humid, then there could be some advantage in terms of avoiding the illness. But that's in the scenario that you have partial immunity. Whereas the vast majority of us right now don't have any immunity to this. So it may not be nearly as effective in reducing the incidence of the disease during this summer, because so few of us have any type of immunity to this particular virus.
Thanks.
Eva, we have a couple of questions that have come in under the chat box. I'm going to suggest that if people have a question, if they can raise their hand by clicking the raise hand box on the at the bottom of the screen, then we can take these questions in order. I'm not sure who RLS is. Is that Rotary List?
That's Rachel Speck, and she's in the chat if you want to look at it, Stephen, or I can read what she's asking. You see her question in the chat.
I can read it. It says, I don't have a camera mic, but want to ask, how cautious should we still be? Do we think we've avoided the worst of it? My work is talking about a slow reopening with remote workers coming back, etc. So that's the question.
I don't think that we've avoided the worst of it yet. but that's a relative statement, okay? Because if we continue to act the way we've been acting, then I would imagine that our low case rates in this particular area will continue to be low. But if we actually open up and start, you know, congregating in groups and interacting and hugging each other and you know, reconnecting with friends and everything that we love to do as human beings, I think that we'll see the results of that, which will be an increased caseload. And it's really just a statistical probability. Okay, every time you get close to somebody who actually has the virus and you touch them or kiss them or hug them or do whatever we love to do, you know, high five, there's going to be a probability, a statistical possibility that you might get the disease by doing so. And so the more of those contacts that we have in our society, the more likely we'll have an increase in the caseload. And so, you know, I don't really know what the nature of opening up will be in different states. I think it's different in every state. But states that don't take any precautions will see an exponential rise in their caseload. States that have a relative cautious approach to opening up will have an intermediate caseload, and states that have continued severe restrictions will have a relatively low caseload, just because of the statistical probability of transmission with every human contact. So I don't know what the right answer is with regard to the economy of our country and our state and our local economy. You know, what is the right answer? But all I can tell you is that the more contact there will be, the more disease we'll see.
There's a second question in the chat room, and it's from Stephanie Kilmer. She says, Doctor, with the different symptom profiles that are happening and with thousands reporting they did not have a fever, is there another symptom profile they look for when entering the facility?
Well, they're asking people whether they're well or not. And most people don't feel well with this illness. So even though they may not have a cough or a fever, most people don't feel very well. And so that's one of the questions that are being asked. But the most common symptoms relate to fever and cough. And then secondarily, there are other symptoms that include things like nausea, vomiting, diarrhea, and also lack of smell, apparently.
Okay, some hands that are raised. Who's got their hands raised here? Bill, do you want to let the hands go up?
Jesse Dorfmeister has a question.
Okay. Jesse? Where is he?
Jesse, I've unmuted you.
He's
Hey,
still
Jesse?
muted.
Yeah, no, I just wanted to mention that there was also a case in the community which has been a little bit confounding. It's an older female person that really didn't have much contact whatsoever. Can you hear me?
Yes.
Okay.
Yeah.
No contact whatsoever with Shutter Creek was known. Person pretty much stayed at home except going to Walmart on a few occasions. The patient is not sick per se, does have symptoms of, really mild shortness of breath and no fever, but the patient was positive, and the patient's spouse is also exhibiting similar mild symptoms, both of which have no contact with Shutter Creek. So this is the thing that, someone asked the question of, how much more spread will there be in our community? Well, we're kind of just getting started, and in our community here, if you look at county to county in Oregon, our numbers have really increased over the last few weeks. So we'll see.
Okay, Melanie Hawk has a question. Melanie? Unmute. Okay. Melanie, are you there?
Hi there.
Here, what's your question?
I was just curious about testing. You know, we hear everyone's going to be tested, and so I was just kind of curious in our community, is that something that has been talked about, or if you had any insight on that?
Well, statewide testing has been sorely lacking. In fact, nationwide testing has been very, very lacking. And I just was involved in a seminar this morning from physicians at OHSU, and their capacity statewide to do testing on a daily basis is somewhere between 400 and 800 tests. And all of those, almost all of those, are done manually. So none of the tests in Oregon right now are automated. And all of that manual testing that they're doing is limited by the lack of supplies, lack of what they call reagents. To actually do the type of test on the nasal swab that you need to do, you need quite a lot of chemicals, a lot of equipment, and they are lacking in that. They do have the ability to do what they call rapid testing, but they only have a limited number of test kits. So their ability to do the rapid testing on a daily basis is restricted to 20 a day. So we in this area have really suffered from that lack of testing because we just happen to be in a somewhat remote area, and we're at the end of the line in terms of, you know, the supplies that we get. And so we've had severe restrictions. That being said, it has got better. And so right now, we are testing people who have, you know, severe symptoms and moderate symptoms. I'm not sure if we're testing people with mild symptoms, and we're certainly not testing asymptomatic people right now. The only asymptomatic people that we are testing right now are people that might need surgery, because we don't want people who are going to go and have surgery and, for instance, get intubated to give, you know, to potentially give COVID-19 to the entire surgical staff. So those people are being tested, and our turnaround times have improved from about 1 week and currently are about 3 days. So there is some improvement in our testing ability. But the governor has identified testing and contact tracing as a major strategic goal. And I would presume that Oregon will ramp up its testing ability and not be so dependent upon national supply in the near future. So I'm hoping it'll improve greatly.
Wonderful, thank you.
So Rick Rayfield and Ida Joe, you have a question? Unmuting. There you go.
It really follows on the previous question, and it was about testing capability based on something I saw in the world, that North Bend was either leading that effort or heavily involved in it. And I think you already answered that our testing capability is very limited here right now. So any increased need for that because of reopening would put a real strain on our system. Is that a fair summation of what you were getting at, Stephen?
Absolutely, absolutely. You know, to open up in a broad way, such that life goes back to normal the way it was, would be impossible without extensive testing. And we need to have testing that is not only readily available, but also immediate. And so, you know, if people get tested and then they go back home and 3 days later they get the answer, there's far less adherence to the need to self-isolate. And we need to know these things right away. So yeah, we need to have not only the ability to test, but we have to ramp up what's called contact tracing. So once you have somebody that you know has disease, that you go through all of their contacts and get in touch with these people and encourage them to self-isolate. And that's really the only way that we'll be able to restrict the spread of this disease while being able to increase our or decrease our social distancing. So until we have readily available testing and robust contact tracing, then the idea of opening up in a broad scale is probably very dangerous.
Thank you very much.
So Tim Novotny, you're next on the line here.
Yes, thank you, and thank you, Dr. Stephen. I'd like to pull a Sam Donaldson and ask you two quick questions. One is, I had heard something about the aerial mist maybe staying active longer than originally thought, and I was wondering if you'd heard anything about that or anything you can relay about how long, if somebody sneezes or coughs, how long that aerial mist stays active. And then the other question is, I know we're in the middle of it still, and it's hard to think while you're still in the middle of dealing with something, but looking ahead to a potential second wave around flu season, will we have enough? I know when we didn't have enough now, but are we going to be preparing for enough PPEs and so forth for that potential second wave, or is that already ramping up, or do we need to start ramping it up?
I don't think anybody knows how long what they call aerosolized virus hangs around and how long it's viable to transmit the disease. I believe that if there is aerosol transmission, it's much more likely to be transmittable on a inside environment where there isn't, where there's, not as much air transfer. And so in terms of like, what is the likelihood of aerosolized transfer when you're standing outside? I think it's far less because there's a lot of ventilation when you're standing outside. That being said, if you think about, what we believe are the two major, or the major way of transmitting this disease, it's with what they call droplet exposure. So that's why masks are appropriate and why they are generally considered effective, is that if you have a mask on, you're transmitting little droplets, things that are bigger than little mist or aerosolized particles. You're transmitting far less. And then if somebody is 6 feet away from you, the likelihood that that larger droplet would end up, in your mouth or nose or on your face becomes far less. So I think that the combination of 6 feet distance and a mask when you're outside, talking to your neighbor, I think that your risk is very low in that situation, and lower than if you were talking to the same neighbor, standing in his kitchen 6 feet away with a mask on. So I think that, I think it's reasonable to interact from a distance when you're on the outside wearing a mask. Personally, I think that 10 feet would be better than 6 feet, but I don't think anybody knows what the risk is or the relative risk of those distances. With regard to ramping up, I would have thought that we would have ramped up by now, because as I said, we closed the clinic 6 weeks ago. The fact that we don't have, widespread testing, the fact that, we don't have adequate PPE right now gives me pause. And I don't know what the national response is going to be with regard to, the availability of PPE and testing, because I think it's long overdue. I'm just appalled that we can't, that we're still talking about that. In terms of, what is happening locally, we've had great difficulties getting N95 masks. And so, the hospital or the governor has indicated that that doing elective cases can be performed in this state up to 50% capacity as of yesterday, Monday, May the 4th. But the hospital has not taken them up on that because they're concerned about their supply of N95 masks. So, until they are comfortable with their ability to have enough N95 masks and their ability to replace the N95 masks that they use, they have not, they have not proceeded with this ramp up of elective cases. So I don't know at what point N95 masks and other essential PPE will become readily available. I just don't know. I would have thought it would have happened by now.
So Jesse, you're up. You're next on the list here. Jesse Bergmeister.
I don't know if you can hear me or not. In the next couple of weeks, we're supposed to get at North Bend Medical Center the antibody test as well as a rapid tester. But as far as the supplies in order to ramp up testing, that's also going to be a gradual availability and not ready immediately. That's all I had to add.
Okay. Jim Layport, you're up.
Yes, I'm still in Southern California. I've talked to 2 clinics today, my cardiac people and my pain people. And in looking forward, how much of a backlog is there going to be? Because the patients down here are staying away from the cardiac clinic in droves unless they're having symptoms. And I called the pain clinic, and those people, of course, are all having symptoms. And so they just reopened like yesterday for partial treatment for pain people, and they're just slammed. So I'm wondering, Stephen, looking forward, what kind of a problem there's going to be with backlog?
I think you're absolutely right, Jim. I think that there's going to be an immense amount of backlog at all levels. And that's why from the clinic, from North Bend Medical Center clinic's point of view, we believe that it's essential to maintain our workforce. So we have, people at all levels, that are highly trained. We're talking about, right from the people who clean our building all the way, to the surgeons and other providers in the clinic. These people are just, it takes time to put that kind of workforce together. And if we lose them all, it'll be it'll take a lot longer to ramp up and to be able to treat people who will have essential needs related to the backlog. Now, with regard to some of the services that we're providing, that's why we're doing everything remotely. That's why we're trying to see people on the outside of the building. That's why we're trying to ramp up elective surgical cases as much as we can under the governor's guidance, while trying to do all of this safely. And in that way, we're hoping to reduce that backlog somewhat. I have to say that a lot of things have been predicted in terms of what is going to be the result of all of this. For one thing, we have the ability to treat cancer. So we still have an open cancer clinic. There's the radiation oncology services are still available, but there's all sorts of people out there that have symptoms that may be related to cancer that are not seeking help. And the result of that is that our cancer outcomes will take a hit. We fully expect that people will arrive with more advanced disease, and that's unfortunate. Another thing that's happening is people are arriving, with their chest pain 3 days after it started. And as we all know, the earlier that you get into the hospital and have your angioplasty or have some kind of definitive treatment for your heart attack, the better the outcome. And so we're seeing people who sit on their symptoms for sometimes days, and again, that's really unfortunate. Things like stroke. Stroke is an emergency, and if people don't come in a timely fashion, the outcome is much worse. And those are the things that we're seeing right now. But people are frightened to come in. But I think that's, to a certain extent, that's why I'm having this talk. I want people to be aware that they can access medical care in a safe fashion. That's what we've been, that's why we're doing this. That's why people are seeing people on video, on the telephone. That's why we see people outside the building. We believe that we can do all of this in a safe fashion.
Thank you.
Clark, you're next. Clark
Hello.
Walworth.
Hello. Stephen, you just finished up that last question talking about some of the new tactics you've adopted to see people safely, the telemedicine and the stepping outside. And you've also mentioned earlier that you had opened a different entrance for children with respiratory symptoms. That's quite a change in procedures. You've got a clinic there where everybody comes through the same front entrance in order to see dozens of different doctors. And now you've changed that model temporarily. And if I'm not feeling well, I may call up and talk to a doctor over my computer. To what extent do you see that those changes carrying on once the pandemic is over? Do you see long-term changes in how medicine is provided in this country once it's gone, once the pandemic is over?
I do. I think that this telehealth, accessing your provider remotely, is something that is here to stay. And the reason is that it's consumer generated. People are happy not to have to go anywhere and still have their medication reordered. And so that's something that I think is going to change. In terms of having people accessing their care from multiple doors around the clinic, I think that may be difficult in the future. I don't know if everybody would still have to go through the same entryway, but the problem that I see is that we all talk about when this is all over, and there's a possibility that it won't be over for a long time. And so the way I kind of see things is that respiratory care unit, that's a unit that is probably going to be around for some time, because people need to be seen for things that are not respiratory, and they have to be protected from the people that have respiratory symptoms. So even if your respiratory symptoms are things like influenza or even the common cold, it's no way that we can differentiate that beforehand, that it's not COVID-19. And so we really have to maintain that dual service of respiratory clinic and then the services for everybody else. But I can't imagine that we're going to have, like, I think we have about, I don't know, 4 different entry points at this point into the building for patients to access care. And I don't think that's going to continue forever. I hope not. because it's a difficult business model.
Okay, Steve Scheiderman.
Thank you. Question and a statement. I had to step away from the computer for a few minutes, and you were talking about the ultraviolet aspect. Are there certain spectrums of UV or generally all spectrums of UV? And here's what I'm thinking, you know, I go home, I wash myself, I bathe, wash my clothes, but there's things you can't really wash, like money, keys as well, cell phone. Can I throw those on my wife's tanning bed, which is all UV, and sanitize them that way?
I don't know the answer to that, Steve. Sorry. I'm not
Okay.
an expert on
And
that.
and then statement, when I stepped away, I was distributing some hand sanitizer to one of our recipients, and they handed me a card, and this is from Lincare, and it says, "Thank you for ensuring our safety and the safety of our community during these hard times," and then signed by the entire staff of Lincare.
That's lovely.
So
And I really have to applaud what you've done, because, you know, a lot of these services that, you know, in nursing homes and stuff like that, they need this stuff. They desperately need it. So they need PPE, they need, you know, hand sanitizer, and I gotta say, you know, a lot of these people are just heroes, because, you know, they, you know, sometimes when it gets into these facilities, the caregivers get sick, and yet they still soldier on, because there's nobody else that can take their place. So thank you very much for what you've done.
Well, our whole team is real happy to be doing this, and I think we're going to be meeting again very soon to talk about our next wave of recipients of sanitizer. And it's a great committee, and we have a great leader in Carrie Mitchell, and we're excited to be doing what we're doing.
thank you, Steve. And Stephanie Kilmer, you're up. Why isn't she not unmuted?
All right,
Stephanie?
can you hear me now?
Yeah.
I have a question and a comment. First, my comment, when Stephen was talking about, you know, people waiting to get services for things, I actually had an annual checkup for cancer, and I have to say, you know, I've been very cautious, but of all the places that I've had to go, going into that cancer center was probably one of the most safest places I've been to when I've been out and about since this all started. And I think it would be worth it, as, you know, the clinic, as a health leader in our community, to maybe put some information out, you know, about, it's always good to be reminded if you're having those chest pains, or, you know, symptoms that just you don't feel right, you know, to maybe seek the attention of a provider. And as a leader, I would encourage maybe getting something to the press. Of course, that's self-serving because I'm press, but something that would help get that word out and remind people that, you know, these precautions are being taken, and you know, it's a good idea to seek help if you need them before it gets too far along. And then my second piece is a question that Jesse alluded to, the antibody test. You said that will be available at North Bend Medical Center soon, and then you also mentioned another test. Is that correct?
Stephen, are you there?
The question was directed to Jesse.
Oh, Jesse.
Or Stephen, whoever. Jesse had talked about a couple of tests being available. I just was wondering if that's true, and when that will be available.
I don't know the answer to that.
I'm trying to
I don't know.
Jesse. I think Jesse's gone here.
I'm going to have to leave too soon, because I'm going to start at 1. Mike.
Any other questions?
Yes, Eva, I have a question. But can you hear me all right, Eva?
Yes.
Yeah.
Yes.
First of all, I want to give a shout out. First of all, Dr. Stephen, that was an awesome program today. Thank you so much for taking your time to do this. I really appreciate it. I also want to give a shout out to District Governor Rick Olson, who Eva mentioned is with us today. Rick, thanks so much for taking time out of your schedule to join us. Rick's attending more Rotary meetings right now than you could imagine, and I think he's probably more zoomed out than any of us. I have one, possibly two guests today. One is Maggie Greenhill. I don't see Maggie on the list, so she may be one of those that didn't identify herself on the list, but that would be Maggie Greenhill. I also have my wife, Linda Greil, with us today as a guest, and Linda has a question if she can.
Hello, and thank you, Dr. Steve. Appreciate it.
Hi,
A
Linda.
lot to set here. I am asking a question of degree of sanitizing, washing your clothes. We know that when you go out to a grocery store, and we still maybe once a week go to a grocery store, went to Walmart and had them just get our order, put it in the car, and they touched every single item with their hands and didn't have masks or gloves on. They've corrected that, but it makes you realize that when so many people are touching the shopping for you, do you bring those things home and wipe down with bacteria fighting, killing wipes to make sure that that doesn't carry through? There's different people that say, well, it's alive on the boxes you get by UPS for 3 days. And therefore, how deeply do you go to cleanse your environment inside of your home, since it has more of an opportunity than if you were outside to come in contact with viruses that you could have brought in yourself? Do you wash your clothes every time you go out? We wear gloves, we wash our hands, we turn the gloves inside out when we leave the store and get into the car. But I'm not washing every single can that I bring into the house or a bag and things like that. And I don't wash my clothes all the time when we're out. What is really truly the recommended status quo right now today that people are recommending?
Unfortunately, I don't have the answer for you on that one.
Mm-hmm.
I can just tell you what we do,
Mm-hmm.
and that when I do go to Walmart or Safeway, to go shopping, I wear gloves and a mask.
Mm-hmm.
And do I get home and wash all the produce and things that I bought? I don't. I think that I don't have the time to do that.
Mm-hmm.
But I don't know.
Is that overkill?
I don't know the answer to that.
Yeah.
I don't. I mean, we all arrive at some kind of level that we're, of safety that we're comfortable with. But I don't know what the answer is with regard to the transmissibility off of inanimate objects. I don't know the answer to that.
Well, there's been a lot of them, but this has been overall such a wonderful instruction academically, also just social things that you've talked about today and getting together with people. There's so many scared people and anxious that they're not even going outside, some of them. So thank you for taking your time, Steve.
Well, thank you. I have to leave now. Thank you so much.
Bye.
Bye.
Bye to Joe. And Rick, you had a question, but I guess he's leaving.
Yes, I do. And it's directed at all of the people who are on the call today. Wanting to know if any of our members have family members, parents, brothers, sisters in any of our local nursing homes or assisted living facilities, and if they have knowledge on how testing is being conducted in those facilities, how many tests, where they're sending them for the results, and how the care is for those patients in the nursing home and access at assisted living facilities for medical care, and what kind of reporting mechanism is being fed back to Coos Health and Wellness, specifically about those institutions and facilities.
So Stephen is gone, and so is Jesse. So Joe Benetti, do you know anything about that? Where is Joe?
I'm here. I do not know how they're being tested in those facilities. I have no idea, but I mean, I think the testing is limited, as Stephen had mentioned. So I think it's a problem that we're facing, and it needs to be corrected and addressed, but I don't know how or when, hopefully soon.
Joe, since you're on here, can you tell us about what Coos Bay is doing, mask-wise?
Oh, as far as masks, we're moving forward. The firemen are going to start distributing the mask out. As you know, it's been something that we've been trying to instigate and get going. Santa has pledged $2,500. City of Coos Bay is buying 10,000 masks. The Coos County has 5,000 towards it, and we're going to start distributing those masks and cloth masks. If anyone wants to drop them off the fire department, we will be taking to the stores. And then the idea is hopefully we get volunteers to help hand those out and educate people. This is an educational thing as well as having masks available. And so any of those would be helpful. So we're moving forward on that, and we'll keep moving forward in that direction.
Okay, any other questions from anybody?
Just one second. I have a couple of things. I went in to the Bay Eye Clinic yesterday to get my glasses adjusted, and they're using some of the hand sanitizer, and they're allowing one patient in at a time, and they're very thankful that we had that. And the other thing is that Dr. Graham has been making masks for the employees, but she also made masks with wrappers from sterilizing instruments and staples and little ties. And if a patient comes in with that isn't wearing a mask, they're using one of those. It's a one-time use, but I think everybody's having a lot of innovation in creating things so that they work. But I was really impressed with the Eye Clinic and the way that they were doing that. Now, on the nursing home side, I was in Medford in the middle of my training to be ombudsman, advocate for patients in nursing homes, when it was canceled after the first day. The state came down and canceled all training, and all of our ombudsman volunteers are not allowed to go into nursing homes anymore in the state, unless I think we have just maybe 2 or 3 state representatives. So we can't go in, and if anybody had a complaint, we can't, to minimize it. So I do know that that has been halted. And so I was a home health nurse for a while, and I've gone into nursing homes, and I do know that I personally feel that there needs to be a lot of upgrading done in a lot of these facilities, but we're going to have to ride this out, and maybe hopefully in the future we can do something so that other viruses and outbreaks go in, like the norovirus, scabies, in our nursing homes in the past, and we have cures for that, and they go on quarantine, and then it goes away. But I do know that it is an issue, and it does need to be addressed someday by other people. That's just my 2 cents.
Thank you, Deanne. And Ida Jo, you got something else? or Rick to say there? No. Okay. Joe Benetti. Joe Benetti.
Yes.
There we are. Okay. What's going to happen in Coos Bay regarding masks? Because I had to go and get the oil changed on, well, that was in North Bend actually, get the oil changed on my vehicle because I'm driving to Seattle tomorrow and the oil light was on and whatever else. But nobody at that shop where I got it changed, which is a big dealer, was wearing a mask. It was just me. They did have the 6-foot rule, but still they were beside one, everybody was beside one another other than me.
So
So
all we do is suggest, as you know, your husband suggested that we do, and ask people to wear masks when they're in public, in closed spaces, and can't social distance, and have them. We're trying to make every opportunity available for these individuals to have them. That's why, even though I know the disposable masks are only a one-time thing, it's better than having nothing, and it's trying to educate them. And if SWOBA or Southwestern, the workforce, they will supply all employees and employers masks free of charge. And we've tried to get that information out. We've distributed over 13,000. That was as of last week. And so I'm sure that we distributed more than that. And we will continue to do that. So all we can do is advocate people to wear masks, and hopefully they will continue to do that. As your husband mentioned, if we all wear masks, we all believe that will make things better for us. And what's important to me is that we want to open this town and this businesses, and it's important to try to get them going. And I feel that's the way to do that.
thank you. Anybody else? Ida Joe? Yes? Oh, hold on. Got to unmute you. Sorry.
We
No.
just unmuted.
Okay, good.
This has nothing to do with COVID-19. It has to do with saying goodbye to Diego, who I see just left the picture.
Diego. Diego, come back.
I was petting the dog.
Oh, he was petting the dog. Here, it's like.
I'm sure that many other people that are part of the exchange program and associated with our Rotary Club have said this to you or have written it to you. I just want you to know that I appreciate the fact that you've had a terribly unique experience having been in the States during this time, and appreciate your the things that I know you have shared with Eva and Stephen, and being in their home and being helpful to them. And just thank you so much for being here. And at this time, know that we appreciate that you've had a different kind of experience than you normally would have had, and safe travels home.
Thank you.
You know, one of the other Spanish exchange students he's going to be on the same plane as her out of Dallas Fort Worth after he leaves Seattle, which is pretty cool. They're going to be together. Yeah. Any other questions? Anybody want to bring anything up? No, Bill, you got something to say then?
No, just be safe, Diego. It's been great having you with us. Take that hat back to Spain with you, though, will you? That's an inside joke between you and me.
Yeah.
Rick Olson wants to talk here. PG, District Governor Rick.
Yeah, I just want to thank your club for everything you're doing. As we're talking here, I'm multitasking, but I'm listing out all the projects that all of our clubs have stepped up to do during this COVID, and you guys are just a shining star down there. Just a couple of things. This week, as you're doing things, we need pictures of us in action. And Cindy and I were looking at a bunch of the pictures today, and they were pictures with people without masks, and they didn't have any of the Rotary bling in it. So as you're doing good, make sure we get some pictures, because we're showcasing this. We're going out with a press release next Tuesday morning. I've summarized, I've come up with over 250, getting close to 270,000 in dollars that we've generated as our 66 Rotary clubs. And then the final thing I want to put a shout out to is we've put together this business to business directory, and we really are trying to get Rotarians to click and get on that. And the reason that's important is as we roll out and start back up in our communities, I have talked to 50 Rotarians running businesses that are going to look for help of, gosh, come visit me as I start up, you know, give me some love. And I think this is taking off and we're going to send out a blitz on it, but it's for real. There's 520 businesses that if you'll just put in your information, we're really going to push the campaign of Rotarians supporting Rotarians on the way out as we walk out of this. So once again, kudos. As Bill said, I do probably 15 meetings a week. Today, I thank you for the invite. I actually dropped off going to my own club. I had it going on another monitor, but I was so intrigued by your husband speaking and what he's got to say. So kudos to all of you. Just great job. Thank you.
That was a last minute invitation I gave you. I couldn't believe you took it.
Of course, I'll take any invitation from your club.
I didn't think of you until like an hour beforehand. Okay. Anybody else? So, Bill, you want to say some more?
I just want to say be safe, everybody. We're going to put this up on YouTube like we had the other meetings, and lots of good community information here. So thanks, Eva.
Okay, thank everybody for being here and listening and talking, and saying goodbye to Diego. So, here we go. So I'll end the meeting now. Thank you all. See you next week.